First of all, there was a time when almost bar none, the British National Healthcare Service, known as NHS, was the most well known system where people paid zero. Healthcare was considered a right. And right now, it is going through, as we would say in Panama, páramo. It's going through hell. And there's a short video. I want any of you who get a chance, I want to put the link to the article inside of the chat. And for those of you in the chat, you can go look for the article. I'll post the article along with the newsletter at politicsandright.com/newsletter as well. But I want to say something about it. Buenos días, Gerardo López. Saludos. Good morning, Gerardo. ¿Cómo estás, hermano mío? Anyway, the issue is there was a time right after World War II, this great institution was founded. And if you got sick, you just went ahead and showed your card. You go get some health care, whether you needed an operation, medicine, whatever you needed. It was taken care of. It was paid for out of the general funds. And it worked. And it worked for decades. But there is something that most Americans don't realize. We have gotten indoctrination for decades that try to give us the feeling, the ability that only, or not only, that it is the private sector that can do things better than anything else. There's an interesting caveat here that I always try to tell people. The private sector is comprised of shareholders who, create the companies, and if it's a corporation, executives who run corporations, and all the employees of that corporation who actually do the work. A public system is we the people, the government, who hires executives who then hire a bunch of people to do the work. So we have government executives, or meaning managers and employees for the government. We have shareholders. We have executives and the same employees who do the work. The theory that you have been told that is more efficient than anything else since apple pie is that if you have the model that says shareholder, corporation, employee, if that model runs healthcare, that somehow it can be more efficient than the model that says government, executives, meaning managers, shareholders. I want to show the distinct difference here. The one-to-one correspondent is the following. The workers are identical, right? If you're a doctor, whether you work for the government or you work for the private sector, you're a doctor, you have to have the same training. So employees, same thing, right? There's a slight difference. When it comes to employees at that level, you will find that the government employees have more protection than the private sector employees who generally gets less protection. They fight for unions to get better. The executives in the private sector generally get more money. They're paid on bonuses as well. If they're able to create more profits, they get more bonuses. The executives in the government, they make a salary. Then we have the government, of course. All they do is collect taxes so that they can pay the managers and the employees to provide a service. In the case of shareholders, they do absolutely nothing but sit back, put their money in a pool, and wait for the profits to come in. And in the case of healthcare, those profits are equivalent to services not rendered to the people, right? Services not rendered, excess not. That's what it turns out to be. You are made to believe that that model with the shareholders skimming monies for themselves can somehow be more efficient than that model that just has the government, the managers, and the employees. And why is that? They say because it's competition. All right. And the truth of the matter is, there's some truth to that. If I have Pizza Shop 1, Pizza Shop 2, Pizza Shop 3, Pizza Shop 4, Pizza Shop 5, and all of us sell pepperoni pizza, we have to do something special so that Pizza Shop, that you will shop instead of at Pizza Shop 4, you shop at Pizza Shop 2, right? So usually what happens is there are coupons, there are price reductions and all that sort of stuff to entice you to go to that pizza place. So that kind of works in the private sector. Just having one government with one pizza shop, a monolithic pizza shop, it's kind of sick, crazy. It's kind of like, you don't get that variety, right? But there are basically not many ways to fix a broken leg, or if your leg is broken, you want that broken leg fixed, and you don't have any time to go shop around or anything of that nature, right? So before I go further into this discussion, I want to say that every economy should be perfectly bifurcated. In other words, those services that belong into areas where people have choices, competition reigns. But there are areas where people don't have choices. And in those areas, that is where collectively we, the people, should reign, where there shouldn't be any profit motive that generates what kind of care you would get. Going back to the story at the New York Times, the NHS is in bad shape right now. And it is in bad shape because, believe it or not, the private sector got involved. It got that way because, like what Republicans do in the United States, they very much attempt to make government as bad as possible. Try to make it not work so that they can say, well, you see, government doesn't work, so we must transfer this to the private sector. To which I ask you, inherently, what would make the private sector better in healthcare than the government sector? What differences are there? The only difference in the way things work again is the shareholder versus government. A shareholder that does absolutely nothing, and government. So when the NHS began to fail, and I want you to go to the link that I provided in the chat. I'll put it in the newsletter later on. I didn't put it in last night, but I'll add it to the newsletter tonight, and you can find the newsletter at politicsdoneright.com/newsletter. That link has a great dissertation, and it has a video within that New York Times article that explain how the private sector, along with a corrupt government leadership, can destroy something that worked for everybody in order then for those parasites who brought it down to instead collect excesses from the population at large. People, we have to get smart. There are a group of people that are not all that smart. They're no smarter than you and me. What they are is built into their psyche is thievery. And they do it in an antiseptic manner, in a manner that's legal, in a manner that actually increases their reputation. It's a world that is turned upside down. Johnny, I'm coming to you in a minute. It's a world that is turned upside down. We reward that person who can cut cost on the backs of people to make profit. You doubt that? You doubt that? This is the start of the show that was not supposed to be the start of the show, but just because I read that New York Times article, I sort of wanted to put a little nodule in your brain and ask you, first of all, sometimes I'm not sure if I'm absolutely clear in the way I'm making my statements, and I say, hey guys, tell me if you followed the direction of the discourse, if you have a critique, if you have a comment of what I just stated.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.